The best catchphrase that I've heard came from one of my patients a few weeks ago. He actually said, "There is no food that tastes better than my health." I've got so many stories, but I probably should start with the very first one. It was a lady who actually came to my nuclear lab. We always were doing follow-up studies. Well, this one lady, I've got my side-by-side and I'm reading and it looks like it's dramatically better. But on my worksheet, there was no bypass surgery. There was no stent. So I called her on the phone. Said, "I'm sorry, but I think we missed some of the history because your scan has very much changed and kind of want to know when the procedure was done." And she said, "I didn't do a procedure. I did the Ornish diet." That diet had actually reversed her disease dramatically. So that made a believer out of me. It made me, look into Dean Ornish's diet more, realize that he had published this with nuclear multiple times. And so the data's been out there for quite a while. If you want to improve the blood flow to your heart, reduce the amount of stenosis, and improve the small arteries, the endothelial function, you need to do a whole food plant-based diet. We actually did a study at the American College of Cardiology where we took our cardiologist members who were willing to answer a survey and we asked the critical questions. How much nutrition did you actually get in your training? And the answer was very little. And so this is why the leading cause of death in heart doctors is heart disease, because we don't know what to tell our patients, we don't know what to tell our families, and we don't know what to eat ourselves. We're trying to spread that information around and get people to understand that a whole food plant-based diet is good for their patients, good for our society, and for them personally as well. And so there's less stroke, less heart attack. Every risk factor for cardiovascular disease will actually improve dramatically. We could actually wipe out so many chronic diseases, not just heart disease. Anything that involves an antibody or inflammation is probably going to be affected in many people, maybe not everyone, but affected in many people by improving their nutrition.